Okay, I think we're ready. Welcome to the second session, everybody. In this session, you will have some Slido poll questions, so please do have the Slido app ready to vote. But without any further ado, let me welcome already on the stage Chris and Joe to talk to us about tackling the healthcare gap, access and affordability in employer-funded health benefits. Over to yourselves. Thank you.
Perfect. Thank you very much. Can everyone hear us okay? Is that working? Brilliant. Okay. I'm going to apologise to people on the left now because I'm naturally going to do this because my notes are there. So I'll make a really big effort every now and again to swing around. If it looks unnatural, that's just why, I promise you. So welcome, good morning. So my name's Chris Bolton. I'm a growth leader at Mercer Marsh Benefits. So my role really centres around listening to our clients, understanding their needs a bit better in the market drivers, and how we can perhaps help those clients with those solutions. And I'm joined by my colleague, Joe Berriman. Joe's on our clinical team within our workplace health part of our organisation. So a bit of housekeeping. We've already referenced, we've got Slido. We know that audience participation is your favourite part of these sessions, so we're really looking forward to seeing what everyone's got to say. We'll leave about a minute up for the first one to let everyone log in and just do that side of things, and then we'll go to about 30 seconds. So there's about 4 overall, so not too much needed from you. There's also a Q&A at the end, which I know everyone's familiar with. So what we'd say is we've set the day up to kind of have that as quite structured at the end. So if you do have any really pressing questions, please hold on to them, pick your hand up at the end, we'll have to have a conversation. So today we're really focusing on, as the title says, closing the healthcare gap, giving you a bit more information about what the drivers are to that healthcare gap, but then also having a bit of a discussion, a debate around, well, where does the responsibility actually sit to shut that gap? Should it sit with the individual, the state, the employer? And we're interested to see what everyone's got to say. Now, to fuel that discussion, we've got 4 main things that are driving data into it. So the first 2 are going to be joint authored reports between REBA and Mercer and some other contributors as well. The third is going to be a Mercer data set that we've recently released called Health on Demand Report. And all of those 3 things are available at stand 10. If you want to pop by afterwards to download them and have a conversation with one of the team about it, that'd be great. And then the final one, and probably the most important, is everyone here, sort of the lived experiences of people in the room. This is a debate more than a discussion or a lecture, so we'd love to be challenged and to listen as well as much as we talk. So, on we go. So, to get everyone on the same page, on an equal footing around the healthcare gap and what we're referencing when we talk through this, the first REBA report that we're referencing does a really good job of kind of articulating what that is. And it's quite simple, quite simply, the disparity in health outcomes and employment opportunities between the well and the unwell, okay? And a very fair question maybe to ask for this room is, not, well, why do we care, but why should we even have the discussion, right? Isn't that the state's responsibility to start focusing on? And when you look at some of the stats that are around this, I think it becomes really apparent why we should be having this conversation. 150 billion it's costing UK employers at the moment, and there's 2.5 million people out of work, so 2.5 million shallower pool for us all to draw on when we're recruiting. So we absolutely should be talking about this. And these sort of stats show as well that it's not just a nice to have investing in healthcare programs, right? It is a strategic imperative that we need to be focusing on. Now, in our experience, when we've been working with some of our more forward-thinking clients on this recently, what's worked well is when they start combining those health and wellbeing strategies that we're here to discuss with their core business strategy as well, when there's less of a distinction between core business strategy and health strategy. Those lines being blurred is landing really well. And Joe, I know you've been looking through the second report and you've got a few data points that you think parallel quite nicely with this.
Yeah, lovely. Thank you, Chris. Thank you, everyone. So the second report really does demonstrate the evolution of thinking in this area. And it talks about closing the health gap, starting with smarter benefits governance, and really starting with a conversation around access and affordability as being 2 key issues for employees and employers. And so within this, obviously the importance of knowing what it is you have in place and also mapping what you have in place against what you need. So making sure you haven't got benefits that are duplicated or overlapping or there's any big gaps. And so what the challenge here really is the democratisation of healthcare in the workplace. And that is for all of you who want to be able to provide benefits that are personalised and exactly right for people. It's about getting the right benefit at the right time for the right person, because everybody has different issues. And all of that, as Chris has said, is very much guided by a strategic approach. And so if you aren't currently looking at a strategic approach to your healthcare benefits, that would be my key takeaway from this report. Thank you. One of the things I'll come on to do is I'll talk about the Health on Demand survey that we've done, but we'll do a Slido first.
Yeah, so this is the first Slido question. So, like magic, there we go, we switched. So tell us in your own words, now we've talked about the healthcare gap, what do you believe in your organisation can contribute towards that gap? What sort of factors? Now, we're looking for keywords, buzzwords on this one, because all the answers are going to magically appear on the screen and we can sort of take a minute to reflect. So as few words as you can, what do you believe in your organisation contributes to that healthcare gap? And for those of you that not use Slido, I imagine most of you have, get your camera app and hover over the QR code and it should link you through it really nicely. And we'll keep this up for a minute or so, so no real rush. Yeah, cost and budget, not unsurprising. For the new joiners in the room, I'm going to ask that you jump straight onto Slido as well. I'm going to drag you straight into participation. Thank you. Okay, good answers coming through here now. So seniority is a really interesting one and probably ties in with one of the access points that we're going to talk about later, and hierarchy I think is quite strongly linked to that. And we're not going to cover today, but there's some really interesting research we're doing at the moment from a socio-economic standpoint, showing the disparity between access and healthcare to different social classes, but then also the converse relationship of life expectancy and health outcomes. And there's some fascinating work going on that side.
And this does just go to show you, just with one Slido, how complicated and complex the whole benefits and health and wellbeing environment is.
Mm-hmm. Absolutely. So I don't think there's anything massively surprising there, and I'm hoping when you all see that, most of those will resonate for you. Okay, so we're going to jump on now back onto the slides.
So we'd like to talk to you about the Health on Demand survey that Mercer does every 2 years. Some of you might already be familiar with it. So this is a big global survey and 18,000 employees participated this last time. 2025, so it's hot off the press. And it really does have a lens, throw a lens on what employees think about their health and wellbeing and their benefits. And so this morning, what we'd like to do is focus on the 1,000 respondee cohort from the UK, because that's probably of most interest to you, but recognising that if you do have a global interest as well, this will be available. Come to our stand and we can talk to you about it. So this is very much employees telling us what they see as being their health and wellbeing challenges. So thank you. To the next slide. And these are the 3 challenges that we've picked out really to talk about today. Affordability, access and engagement. So affordability, this obviously impacts both employees and employers, but people are increasingly worried about how they're going to afford healthcare benefits and healthcare provision, particularly as they get into their older age. So particularly women, perhaps more concerned than men, which probably you would expect because women engage with healthcare more than men throughout their life course. Access continues to be a big hurdle to overcome. And we know, for example, that many employees don't have access to medical plans. About 70% of employees who are full-time in large organisations don't have access to medical plans. And also, many don't access healthcare promptly when they need to. And then engagement. Engagement is important as we move from the sort of administration of benefits journey through to something that's much more engaging. Thank you.
So we're going on to our next Slido question now. So we're going to have a data point for each of these 3 buckets. So 3 more Slidos. So the first one is going to be a question around affordability. So if we jump back onto the Slido, we've got a stat already that we're showing here. So 18% of millennials do not feel confident in affording healthcare. How many Gen Xers do we believe in the room that this applies to? So what is that stat of 18% going to be for Gen X that do not believe they feel confident in affording healthcare? I'll give 30 seconds to get the answers in or so. Very even distribution so far, I should say. Okay. So I think it's fair to say quite an even spread. Right? No one really jumping down one alley. So if we move back to the slides, the actual answer is 31% of Gen X do not feel confident. And Jo, I know you've got some interesting thoughts on sort of this data distribution.
I mean, interestingly, in the Health on Demand survey, the self-reports of employees, respondents, about their health and well-being has reduced by 8 percentage points since 2023. So not only are people reporting that they're less healthy and well for whatever reason, they're also reporting that the confidence in affordability of healthcare declines with age, which probably is unsurprising given the older we get, the creakier we can get, and health issues arise more frequently. But 10% of Gen Z, 19% of millennials, and as Chris said, 31% of Gen X and 44% baby boomers don't feel confident in affording healthcare, and it worries them.
And what I think is quite interesting with this, when we talked earlier at the front end, we started discussing the interlinking between health and wellbeing strategies and business core strategies, right? It's very easy to think that health and wellbeing strategy will be a one-size-fits-all solution, right? But quite quickly, just with a very basic stat, and there's much more detail to this and many more nuances to it, you can see how if you don't understand your organisation demographics, that you can answer the wrong question more often than not. So what we'd say is when we're working with those clients that we talked about earlier, understanding the demographics today is super important to get this right, but also really importantly, how those demographics are going to evolve over the next 2, 5, 10 years. There was a talk earlier, which I don't know if anyone was at, I can make it around the 100-year life cycle, 150-year life cycle, and 100-year working life. So if we do have a 100-year working life, we're going to need a few more categories, I think. But it does show that there's lots of needs to be met. And when we're putting these strategies in place, yes, they need to pay off today, right? You're not going to get the business case sign-off. It's not going to get through the organisation if there isn't a very short time frame and uptick. But the strategy has to match the business growth ambitions over the next 2, 5, 10 years. It needs to be fit for purpose long term. And only by really deep diving can you start to understand that point, I should say. And what's been really interesting with some of our clients that we've been doing this exercise with is we've started with very basic work, maybe sort of just benefit governance, placement activity, whatever it might be. And it's as we've asked the question why more and more often to dive deeper and peel back a bit. What we've ended up doing with our client contacts is having a really interesting conversation where they start to understand their organisation at a much deeper level than perhaps they did beforehand, to understand the strategic direction from the C-suite, where the business is going. And what we want to say and call out is that we're imploring everyone to take the strategic view, but that should only happen if you at first have that deeper understanding, because otherwise there's going to be a lot of wasted energy in doing things that isn't going to align with the organisation over 2, 5, 10 years, whatever that time frame might be. So we're going to move on. Again, we could talk about this all day, to our next data point. So our next Slido, please, if we can get that up. So 26% of full-time employees have access to some kind of screening. How many have access to cancer screening specifically? So how many employees do we think across the UK have access to cancer screening? It's a very simple question. Responses are coming in pretty quick, so we'll wrap this up quite shortly. I mean, I'll be blunt, when I wrote this question, I didn't realise that I'd given you some of the answer by having the 26% in the sentence. So it's obviously less than that.
Anybody that gets it wrong seeing that really does need to take a view.
So we'll move back onto the slides if we can. So the answer is 10%. So 10% of employees in the UK have access to some kind of cancer screening. And Jo, I know you've been mulling on that one a bit.
Yeah, we have been mulling on that one. And we choose cancer screening, not least because health screening generally is a really easy, relatively, way of intervening early, at an early stage. And when people are worried about their health, it's a good way of helping to reassure them to an extent. I'm conscious that some people in the room are very knowledgeable about health screening. So, but despite the popularity of preventative screening benefits, provision of these benefits remains low. So, you've instantly got a contradiction there in terms of what we're seeing. And as Chris says, 10% of employees have access to cancer screening. That could be a proxy for other types of screening. 41% of cancers are diagnosed at a late stage, and 32% of patients are still waiting for a treatment plan 2 months after referral. And of course, as issues with the NHS, continue, which we expect them to do, this makes the importance of employer-led health and benefits services interventions even more important, because I thought that those figures were really quite stark. And cancer is a perfect time, of course, when you really need early intervention. So, important in encouraging people to participate with their benefits programme.
I think that's really interesting. I think it's, like you said, a real big contradiction in the stats there in the middle about the potential upside behind the screening programs, but the lack of provision. And I think sometimes from my perspective, screening can be seen as a ready-made solution to put on to sort of future risk prevention, right? And from my mind, it is part of the solution, but it's not as simple as that. When we discussed earlier in the previous slide about understanding your demographics better, right? If we take that as a baseline, as an exercise we've already done, let's assume we've done that. What it enables us to do is have a much more targeted approach to screening with very specific risks that we're trying to offset today in 2, 5, 10 years. We can have a much targeted approach to it. Excuse me. Pardon, sorry for the cough. And that targeting should come from data. That should be a very data-led approach. Now, in my mind, the magic mix of data is quantitative and qualitative, right? There needs to be a good blend between the two. And in real terms, all that really means is understanding your employees, their risk, and your organisation, a very, very basic level. Now, some of the work we've been doing with our clients over the last couple of years has stemmed from a tool we have called the People Risk Modeller, which does a very good job at putting out the quantitative data. Right? And you'll see a lot of that in the market at the moment, people are accessing that data for you, making it visible. It's only when you start to overlay the qualitative side of things, so benefiting from the lived experience of the employees, from the leadership team that's crucially important, from the line managers are seeing this on the front line, as well as then capitalising on that deeper understanding we've already talked about, that you really start to perhaps unlock the potential that sits behind the benefits programme. I'm also very keen to stress that what we're talking about today as we start to paint that picture for you isn't the end point. That's not what we're trying to get to. It's kind of the starting point. And what we'd want to see happen is that as you're putting in place those targeted programs in screening or any other benefit line, the data that then comes out of those benefit programs should go back into your decision making, which means you can make even more targeted decisions next time, which generates better quality data. And you can see very quickly that loop flywheel starts to take off very quickly. Now, Jo and I, and definitely Jo, could spend hours talking to you about perhaps the lack of use that most companies use on their screening data or on their pathways data. We'd love to do that more. Again, Stand 10, if that sort of conversation interests you, please come by and we'll set some time up because it really is fascinating. Now, moving on to our final Slido, you're going to be pleased to hear. How many employees do you believe would class themselves as thriving in your organisation? Now, the definition of thriving, I'll leave up to your interpretation because we didn't steer the cohort in any way. That is the only wording they saw. So how many of your employees would you believe class themselves as thriving?
Depends on the day of the week, right?
We're not getting the results on screen. Give a second for the teams to catch that up. Oh, we're resetting, sorry. Oh, there we go. As if by magic. It's disappeared again. Oh, no. There we go. Right, fantastic. A real big distribution there. So 21 to 30 being the most common, and then quite a big distribution. No one's gone that generous, let's be honest. 61 to 70% is our highest there. So what the survey showed, if we move back to the slides, thanks guys for sorting that. If we move back to the slides, is that 44% said they were not thriving. So actually 66% are saying thriving. And Jo, I know you've been sort of diving into that a bit.
Yeah, no, absolutely. I mean, I just wanted to kind of sit with that for a little while because that's, to me, that's a big number. 44% of employees, almost half of employees, not thriving at work. What are the implications of that? 42% reported feeling stressed most days, and 33% were actually actively seeking opportunities with a different company. So you can see the correlation there between health and engagement. And the evidence in that respect, outside of this survey, is very strong that engaged employees are less likely to report health and well-being issues. And so I think it's really important here, the message is that think strategically, as we've said all the way throughout this session, think holistically about your benefits, but also think about the organisation and the people that you've got working for you, because the whole health and well-being is impacted by many, many different factors, of course, and many of them you'll be familiar with. And so we need to think about, well, what about the organisation? How is that facilitating health? Not just in terms of benefit, but perhaps in terms of, engaging work, flexible work, the design of work. What does it look like? Are we asking our people to do reasonable jobs? Are their jobs good work? Are they doable? What about your people? Who are they? What age are they? What demographics? What's going on for them? Because we've now got 5 generations in the workplace, and each generation with different needs and expectations of work. And then also, what about the people who kind of, to use a big annoying word, operationalise your health and wellbeing strategy on a day-to-day basis? In other words, your managers, are they competent, equipped and able to, manage health and wellbeing issues? Do they need some training? What do you need to do to support them? Sickness, absence management, etc., etc.
And I think to me, this is the most fascinating data set, which is odd because it's probably the least clinical, right, what we talked through today. And we're here to talk closing the healthcare gap, so we'd assume that we'd land clinically. But I think when we think about maybe one of the questions we posed at the front end of the day, where does the responsibility sit to close that gap, we posited. And I think what this does a really good job of saying is that a large part of that does sit with employers and, to be honest, the people in this room, right, to take that accountability forward. And when we look at some of the parallel research that we do at MMC, so we run our global talent trend survey, and our management consultancy firm, Oliver Wyman, do a black and white paper on CEO priorities. And there's a real strong connection between trust and performance. So we know that employees' trust in their organisation is the single highest indicator of a high-performing organisation and culture, right? So we know that. It's very simple. And we also know, parallel to that, that employees' trust and belief and faith in their benefits programme is one of the strongest indicators towards fostering that culture. So those parallels start to line up really, really quickly when you break it down that way. And when, again, we think at the front end and we put those stats up, so that how much it's costing us, the number of people out of work, that was a very macro way of looking at the problem, right? Big numbers that we can all try to chip away at. But when we talk about this at an individual organisational level, it quickly becomes very micro, and to be blunt, pretty selfish for everyone in this room, I think. Like, all of us in this room want to work at a high performing organisation. And that's a very clear statement. None of us would go to work if it wasn't enjoyable, and performing is enjoyable. But reflecting on some of the other stats we've seen today about, this industry is decades old in talking about these sort of things, and we are still at the point where these stats are prominent. We're still at a point where nearly half of employees aren't thriving at work, where a third of your workforces are looking elsewhere. So we have to accept that we've not got it completely right so far, and this is part of the debate on why we want to have it. We need to be aware and own that and have the conversation. And we think that what we've talked through today, so peeling that back of understanding your organisation deeper, making educated decisions with a 10-year time frame, aligning to strategic objectives, is one way to do it. That's not the end of the answer. And we hope that we've sparked some thoughts in the audience, and that maybe some of that will come out in the Q&A. But again, anyone wants to have this conversation in more depth about your organisation, please come and talk to us, because we'd love to talk to you more. And that's the end. We're at 13 minutes. I think that gives us 13 minutes for Q&A, if I'm right. That's it. Thank you, everyone. Appreciate your attention.
So we do have some questions. So the first one is around data. How can you get qualitative data in a GDPR-friendly way without necessarily having all the tools and means that Mercer has? What's the advice for the audience to go about that?
Shall I take this one, or do you want? No. Yeah, my favourite subject. Who asked that? Do we know? Yeah, wonderful. Good question. Well,
I'd probably just get it out from the life insurance and other stuff. So
I know. I know. Yeah. Well, there's a number of ways. Obviously you will have engagement, and there's sort of a spectrum. So you will obviously have engagement surveys, etc., all the standard tools that you would use as an organisation where you can ask health-related questions. And there are a few, there's probably about half a dozen good standard health-related questions that you can ask. Other than that, next stage up, you can undertake focus groups. That's something that sometimes we do with clients depending on, the project that we're working on. But you can also do that yourself. And so, again, you have an agenda, you ask questions, you receive the responses, transcribe, that's a nightmare. And you get your data back. Often verify it with the group after it's been done. Just to check that you've got the right thing. Other than that, there are more interesting digital means of getting data, and we do work with a number of companies, and we have undertaken qualitative survey data digitally on a number of different occasions, and that adds a whole nuance to your questioning and your receipt of answers. And some of those digital tools, you can actually kind of ask sub-questions and engage at the same time.
And I think there's also an interesting point around, I'll use the phrase the quality of the questions you answer, because I think most of it's going to come down to question, right? And you can sort of peel questions back into 3 layers, and most people start with the first one, which is, are we doing things right? Right, it's kind of the framing of the question. Are we doing things right? Is the question they'll ask. The second layer, which some people get to, is, are we doing the right things? Right, so it's taking that step further. The third one, which I'd encourage to be in there, which we often don't see, is, well, why do we do the things we do? It's a very simple way to ask it. And let's, a bit more audience participation. Stay with me with this. I promise you it's got an okay payoff. So hands up in the room if you're in some way involved in decision-making for an employee benefits programme, advising, decision-making, budget, whatever it might be, but you're part of that process in any shape or form that you've got a say on the matter. Okay. So let's say most of the room. Keep your hands up. We're not done yet. Don't worry. Keep your hands up. Right. Put your hands down if you were the person that completed that from scratch. So keep your hands up if you inherited it, effectively. So first, hands down if you were the arbiter of that. Okay, so 70% of the hands are still in the air. Now, keep your hands up if you was not given, during a handover, the answer to the question, why do we provide these benefits? So hands down if that was given to you in your handover. Okay, so about half the hands are in the room up. So about half the people in the room are involved in decision-making for employee benefits program, but have never been given the answer why they provide that program in the first place. Okay, which is a very simple question that everyone should be able to answer about any decision they make in life, let alone something very complex around employee health. And the honest answer is, say that program was set up a decade ago. That answer has changed 4 times in that decade, right? The world has evolved, the economy has evolved, the business has evolved. That sort of mindset is something we would want to see our clients take into their organisation every year. So it's not just market review, here's the terms, what we're trying to achieve, this is the population. It's, well, last year we were really focused on this. Has the why changed? Because if the why has changed, everything needs to change. You need to start the process again. So I think, see it from 2 angles. Talk to the organisation. Why do we provide this benefit? Someone knows. Someone is signing off a cheque for £1 million a year. It's not by accident. Someone knows that answer. And then speak to the employees from the bottom up. Are we meeting that why? You know, are we meeting your engagement levels? Are we an attraction retention tool? Whatever it might be. It's a very nuanced answer, I know, and a very consultative answer, so I apologise. But I do really think it's important.
What we're clear about to do is look at that question, because the answer at the moment is we provide it because we should provide it.
Yeah.
Not why we're providing it because of what return on investment or what should we be providing that exact piece. So
Yeah.
I agree with you.
Fantastic, thank you.
Okay, so moving on to a different topic, the data's really interesting, but do you know, or what would be your insight on how that has changed pre and post-COVID? What's been the trending and the key themes?
This was like a clinical answer, Joe. I think you can take this one.
Okay, well, post-COVID, we know that we now, if you talk to any of you that have occupational health services, for example, any of you will know that the cases that are going to occupational health nowadays are more complex. They're more likely to have multiple conditions wrapped up into one. We call that comorbid conditions. And often, unfortunately, potentially with an employer grievance or whatever it is related, an employment-related issue as well. So we know that there's more mental health. We know that there's more musculoskeletal conditions. We know that neurodiversity has become like a huge thing, almost overnight after COVID. Although, interestingly, neurodiversity in itself is not a big thing, depending on the country in which you're at. So some countries it's bigger and more recognised than others. So we know that there are certain things, and obviously, you know, with neurodiversity comes secondary mental health conditions as well. So the issues are more complex. The issues often have an employment dynamic, and the issues are more associated, more likely to become protracted. They have the potential to become protracted, and another reason why early intervention is so important.
Okay, thank you. Really interesting one has just come in. How do you best manage changes to benefit offerings without violating that psychological contract of trust, given how strongly you highlighted trust of employees for their employer?
Really good question, because I think everyone in this room will have seen the change curve, right, and understand managing change through an organisation. But I always think benefit adds something or dials up the emotional relationship with that change curve, right? Because everyone's going to have examples where a relative or themselves are invested in the system, they've seen some benefit, they don't want the threat of that being restricted, right? It's the fear of change more than anything that gets started up. And I think what lands best for me, and this isn't just in this sort of situation, but anything from a business lens, is authenticity. Authenticity has to go throughout the organisation, throughout the leadership structure, and certainly when it comes to benefits. I often find employers that are disconnected maybe from their employees and making decisions and not quite thinking through the impact. just tend to hide behind decisions, right? They might make a decision for one reason and then communicate to employees another data point for a completely different reason, right? We will all have seen that in our lives when that happens, and everyone really knows why the decision was made. Employers shouldn't be scared of acknowledging the fact that they are an employer in a competitive market that needs to make business decisions, right? Bring employees into that. And we talked earlier about understanding the why. Done the right way and bringing employees into that conversation around change management, it's, well, this is where we are today, to our discussion earlier. This is why we provide these benefits. This is what we're trying to achieve. And this is the gap between those two situations. We want to close that gap with a little impact on you individually as possible. Can you help us get there, right? A very open conversation with them. Now, it's not going to be a perfect answer you get back. Of course it's not. But you do that enough and socialise it well enough and talk to employees about it, and that then spreads out through the organisation. It's no longer an aggressive change made for selfish reasons. It's a very logical change made because this company needs to survive a long time. Okay, because otherwise no one else has a job, right? It's very, very simple to understand. So be authentic with it. Don't hide the decision behind layers of other reasons, and yeah, that just doesn't land. That's my opinion. But if anyone's got any experiences that are different from that, I'd love to hear it, and I'd love to talk that through. People are still learning on that.
So another completely different one.
Sorry,
go on.
I think this lady here had a...
I was just going to say communication, because as you said, it's communication, because what is not done very well in the HR world is, as you said at the beginning, looking at data to start with, because that gives you information to be able to communicate it. But communicating why you've made that change and what it's actually doing versus what their perception is, because with health, perception is such a strong indicator. So as long as you're communicating and educating them as to why it makes sense, then it can be helpful.
Yeah, I massively agree.
Thank you. Yeah, completely different question. Observation in some ways. PMI is quite prevalent in organisations. What you said about cancer screening has obviously resonated, but of course PMI policies don't generally include elements of screening or prevention. So, is that just another cost, or is it about repurposing other screening budgets, or, what would be the advice to how could we include that without busting the budget? The golden question.
It's a very good one, and there's no perfect answer, right? No one's got a magic pot of money sitting on the side that they're not spending. So what we try and do, and what helps, not just with the screening question, but with any change to benefits or anything related to people, is to help the business see the budget as one, right? So start that conversation as, okay, this isn't 50,000 on this and 100,000 on that, it's one budget. And if we can make solid tactical moves in one area to free up the budget, can we reinvest that back to our why of we're trying to achieve this? As long as the business has co-signed that off and is on board with that, and you can articulate, great, we've now got a spare £20,000, the biggest move to meeting the gap to our why is this, they'll be on board. Where that doesn't happen, and we'll all have been in the situation, you'll free that £20,000 up, and within 10 minutes it's gone, right? Someone sucked it up, needed it for another project. So you've got to get the decision-making committee, whoever that is, the C-suite, on board with the overall, that 5 to 10-year strategy, right? They need to be invested in it. It should never be a surprise. And we talked through earlier, when we put our hands up, we talked through the handover process and the socialising of that document. Where we work really well with our clients, we have a kind of central, almost contract with the client that's not legal. This is okay. This is where you're going at the top level, right? You're expanding into these territories, you're launching this new product, diversifying, whatever it might be. This is the people risk element to that, and this is how we're going to support you. And we co-sign it. And we ask the senior decision makers at the organisation to sign off on it, whoever that might be. So then when we're putting the business cases in, you've done half the work. The decision, it's not a surprise to them that you're bringing this conversation because it all ties back to the same reasoning. Finding the money is the trick. And I haven't got a magic wand for that. I would say really the cost of doing nothing, yeah, it's something you've got to articulate, but also real front edge organisations, and this is very difficult to do, so I apologise if it doesn't resonate, can start to look across their other partners within the business into other human capital, so employers' liability, for example, and general insurance, which will feel alien, I know, to lots of people in this room. That is an incredibly soft market at the moment, and brokers are driving huge savings out of those big employers' liability premiums, which has risk connectivity to your programmes anyway. If you can start having that conversation again to the senior decision maker of, let's see this as one cost, and if we free up 10% from this programme, can we reinvest that? That's, in my experience, the most consistent way to get the outcomes you're looking for.
Okay, we're nearly done, but and there have been a lot of questions, so please do visit the team on the stand for individual questions. We haven't got through them all, but just in the remaining part of a minute, what would be your thoughts on, we've talked a lot about what employers can do, but what about the individual employee's responsibility in this? What would be your comments there?
It's always a popular question, this, and my view is always, yeah, employees also have a responsibility to look after themselves and not to have things just done to them and come to them. But in order to engage them to do that, you as an employer have to set the right context in order for them to grow, flourish, thrive.
Perfect. Thank you so much, and thank you for allowing so much time for questions, and there have been more, so clearly a huge interest in the topic. Thank you.
You're very welcome. Lovely
Thank you, everyone.
to see
Lovely to meet you all. Thank you.